Peyronie's disease is an illness with a complicated name. It's an extremely unpleasant condition. This is a disease in which the penis can curve up to 90 degrees, leading to what is called anatomical impotence. A man cannot have sexual intercourse because during penetration, when entering the vagina, the penis simply slips out of the woman's genital tract. In medical terms, this is called fibrous induration of the penis. Some doctors have difficulty even recognizing what this disease actually is. In reality, the situation is quite clear. There is inflammation in the penis, specifically in the part called the tunica albuginea, which is the inner part of the penis. This tunica albuginea becomes traumatized, inflamed, and the inflammation progresses pathologically, leading to the formation of dense scar tissue that causes the penis to curve. As this scar tissue matures, it contracts, pulling the penis in that direction and causing it to bend. That is the nature of this disease. In the later stages, when the penis is already curved, this condition can only be treated surgically. But in the early stages, when the disease is just beginning, that's when we get involved. Very few specialists in Russia work with Peyronie's disease at this level, at this stage. But we managed to correct this plaque. In fact, I can't recall a single case where a patient came to us in time and still had to undergo surgery. When is it necessary? This is an important point. When should you see a doctor? You should see a doctor as soon as the process is just beginning to form. When pain suddenly starts in the shaft of the penis, it always starts with pain. You might not even be able to palpate the plaque yet. That's when it's important to see a doctor. And if you can already feel the plaque, you need to see a doctor tomorrow. How should Peyronie's disease be properly diagnosed and treated? The method for treating Peyronie's disease is chosen only based on ultrasound results. Ideally, the ultrasound should be performed by the urologist themselves, because the plaque needs to be seen and its condition understood. The treatment method is determined by how hard the plaque is, and the methods are completely different. It's either therapeutic treatment with pills and physiotherapy, or it's surgical treatment involving shortening, implantation, or inserting what's called a graft, right? That's why it's important to make a clear decision. We determine this only by ultrasound of the plaque. If calcium starts to deposit in the plaque over time, it eventually turns into bone, a small piece of bone. At the bone stage, of course, no physiotherapy or pills will help you anymore. At the development stage, when the plaque is fibrous but not hard, there are special medications that work very well for treating Peyronie's disease, and we use them. There are resorptive medications that convert type 2 collagen into type I collagen, and then the plaque will be elastic, it won't bother you, and it will hardly be noticeable. No one will ever know about it. That's one. There are also topical medications for application to the skin. There are medications for physiotherapeutic treatment. Shockwave therapy is also available. We don't use it, so please don't ask about it, because shockwave therapy is widely advertised, but in my opinion, I don't like it. I use completely different methods. They are more cost-effective, more beneficial for the patient, and their results are significantly better. And the plaque dissolves quite well. Within 2 to 3 months, it is already noticeably lysed, fundamentally. And most importantly, the process stops. There will never be any curvature. Here's another important point. Peyronie's disease is not just about the plaque. Peyronie's disease is a condition of the whole body when there is a readiness, a predisposition. Why is there such a predisposition? Because the patient simultaneously has several factors present. This is, as a rule, a feature of the general condition. And that's why Peyronie's disease occurs after 40. It's also a feature of the genitourinary system. And we have a method for treating Peyronie's disease that is based precisely on proper diagnosis and on properly restoring, on clearly and explicitly restoring the patient's health as a foundation, and then on clear and systematic treatment of the plaque itself. That's why we achieve results.